You are watching Health Talk, powered by HCN. In this week's segment of Health Talk, we are going to discuss POA, a common term that we often hear in healthcare, power of attorney. We're going to talk about the do's and the don'ts, what a power of attorney can do, the differences between a financial power of attorney and a healthcare power of attorney, and when it's necessary to obtain a power of attorney. Stay tuned. Like most legal undertakings, setting up and enforcing a power of attorney can be quite confusing. However, these essential tools actually helps the families and aging adults to create a solid plan for future care needs and also to gain a peace of mind. Power of attorney documents allows a person, also known as the principal, to make decisions on whom they trust and want to act on their behalf in the event that they become incapable of making decisions for themselves. The person who acts on their behalf is known as the agent. From there, it's very important to distinguish if the agent is going to be the medical power of attorney or the financial power of attorney, or both. In most cases, the power of attorney, the person who's appointed as the power of attorney, acts as both financial and medical. But in some cases, a principal has every right to choose two different agents, one to act as financial and one to act as medical. So let's talk about what a healthcare agent can do. A healthcare agent can decide where the principal gets its care, be it surgery, hospital care, psychiatric care, home health, etc. They can also decide where the principal lives, be it a skilled nursing facility, long-term acute, or stay at home. The healthcare agent can determine which doctor is going to assist the principal, which caregiver is going to assist the principal. Healthcare agent decides what the principal eats and who bathes the principal. A financial agent has access to all of the financial accounts of a principal to pay for healthcare needs, housing, and other major bills. They can file taxes on behalf of the principal. They can collect all of the principal's debts and also manage the principal's property. So let's talk about what a power of attorney cannot do. A power of attorney cannot change the principal's will, nor can the power of attorney act on behalf of the principal after death, unless the principal specifically appointed that agent to act as their executor, or if the principal passes suddenly without a will, the agent does have the right to petition to be the administrator over the principal's estate. Now, a power of attorney also cannot just pass on its power of attorney duties to just anyone. The principal would have specifically had to name a co-agent, or if the principal is still living and capable enough to name someone else as an agent, then that's the only way the power of attorney can pass along its duties. So let's recap. The principal is the person who actually appoints someone to be their power of attorney, and the agent is the one who's acting on behalf of the principal, the power of attorney. Know that there's two different types of power of attorneys. You have your medical and you have your financial. It is perfectly fine to appoint one person to handle both medical and financial needs, but it's also perfectly fine to appoint two different people, one to handle your medical and one to handle your financial. Please know that power of attorneys are very, very important and needed in such times when you're taking care of your loved ones. It's never too early to appoint someone as your power of attorney. So go ahead today and start thinking about your affairs. Get your affairs in order and who is going to be your power of attorney. Good news for the state of Texas. If you've been waiting to receive the COVID-19 vaccine, wait no more. Starting Monday, March 29th, all adults in Texas will be eligible to receive the vaccine. That's right. Even if you do not meet the criteria of Phase 1A, Phase 1B, or Phase 1C. If you're an adult and a resident of Texas, you will be eligible. Texas Department of State Health Services has directed all of its providers to prioritize and accommodate those that are 80 years and older. What that means is they will not have to make an appointment, nor will they have to wait. They can go to one of the public health clinics that's providing the COVID vaccine, and they will be skipped to the front of the line. The Department of State Health Services will provide a website and a toll-free number come next week that will keep you informed with what public health clinic in your area will administer the vaccine. For more updates, please go to www.dshs.texas.gov/COVID vaccine. Speaking of COVID, it's almost time for our second round of COVID vaccines for our staff and patients and their families. Hey, I had the pleasure and the opportunity of capturing pictures and videos at all 3 locations. Every week, I would like to bring you a word from one of our patients. And at our Rockwall location, we had such a sweet patient who had nothing but great things to say about Home Care Network. And in Palestine, we had another patient who had nothing but great things to say about their nurse. Check out these testimonies.
I've had a really good experience with Home Care Network. I've been with them since 2015, 6 years, and my experience has been very good. I've had good nurses and good aides and assistants, and I just couldn't recommend them too highly.
Hi, yes, I get Home Care Network. My nurse that comes to the house is named Diane. She's wonderful, and she comes once a week. And she's the one that got me to come get the vaccine, and I'm so glad I did. So, anyway.
And in less than a week, we'll be back at it again as the patients and their families come to receive their second dose of the COVID vaccine. It is such a blessing to be a blessing to those that we serve every day. That concludes this week's segment of Health Talk, sponsored by HCN. Be sure to tune in every Friday where we give you the latest updates on COVID-19. Also talk about what Home Care Network is doing in the community and give you some fun health facts that you may or may not have known.